Gastric bypass surgery for weight loss has become a widely accepted practice for improving the health of obese people. But for the obese with diabetes, there is another reason to consider the surgery. In addition to weight loss, a gastric bypass usually sends type 2 diabetes into permanent remission.
What we'll see is patients come in on insulin in the hospital, have their surgery. About 3 or 4 days after their surgery, as they're being discharged, they've taken their last shot of insulin in their life.
Dr. Matthew Weiner is a surgeon at the Detroit Medical Center.
I think anybody who suffers from obesity has had the experience of losing 30, 40, 50 pounds, maybe even 100 pounds. But the truth is, only 5% of these patients keep it off. The wonderful thing about a gastric bypass, and what I tell all my patients, is you're not coming to me to lose weight. You can lose weight with diet and exercise. Everybody can. You're coming to me to keep it off. And with the combination of the gastric bypass and the diet and exercise, those two techniques together are what succeeds.
Dr. Weiner has more than a few patients who will attest to the success of his approach. Carol Thielander weighed nearly 300 pounds before going to see Dr. Weiner.
I didn't have quality of life. I was sitting here on the couch, like couch potato, all the time. I didn't go anywhere. I wasn't active with my children. It was pathetic. It really was.
Along with her weight problem, Carol suffered from diabetes.
Before surgery, I was taking 200 units of insulin a day. Now I'm off the insulin, and I'm only taking pill form right now, once a day. The plan is to totally be off the medication here within the next couple months.
Carmela Pulis, another of Dr. Weiner's patients, explains why she sought his help.
You know, it was like a shock when I was told I had diabetes. I had no inclination or idea that I had it. And I tried everything my doctor, recommended for me, diets, drugs, and found it very hard once I got on insulin to lose weight. I started talking to people that had had the surgery, and I says, well, maybe that's what I need to do.
Gastric bypass today can be performed as a minimally invasive procedure through several small incisions in the abdomen. The surgeon inserts instruments, including a tiny camera, through these incisions and divides the stomach, creating a new smaller stomach pouch from a portion of the original. The surgeon then connects this new stomach pouch to the digestive tract, bypassing a portion of the small intestine. It is this bypass that seems to have the positive impact on diabetes.
It's not the weight loss that's doing it. It's when you perform a gastric bypass operation, you alter the flow of food through the intestinal tract.
For reasons which are still not fully understood, that alteration in the intestine has a profound effect on a diabetic's ability to manage blood sugar. Coupled with the weight loss, obese people with diabetes are frequently being cured of their disease.
What we're now starting to understand is that if you take two groups of patients who have just been given a diagnosis of diabetes, and you put half of that group and let them have a gastric bypass, and you have the other group managed medically with medications and insulin, what you're going to see 5, 10, 15 years later is going to be incredibly dramatic. The gastric bypass patients are going to have complete resolution of their diabetes with no health problems at all whatsoever, whereas the medically managed patients are going to have kidney disease, they're going to have glaucoma, they're going to have peripheral vascular disease, they're going to have coronary artery disease.
Does this mean that people who are not overweight, who are diabetic, should consider gastric bypass?
Well, that's a very interesting question, and that's something we're really starting to look into here at the DMC. The question of how can you treat non-obese diabetics?
The use of surgery for non-obese diabetics is something which is under study at the DMC and elsewhere, but today, this surgery can literally be a lifesaver for obese diabetics.
My dad has a lot of health issues, and he passed away in August because of diabetes, kidney failure, and I did not want to go down that path. I want to lead a long, healthy life, and the way that I was leading it was not good.
And how do these patients feel now?
I feel excellent. I have so much more energy. It's just amazing. It's all the cliche stuff that you hear. And I'm feeling the cliche. I have more energy. I love my life now and able to love my children and love the things that I do. And I don't sit on the couch. And I joined a gym. If people know me, they know that that's not me.
I just feel better, health-wise. I'm not on insulin anymore. I stopped it the day they released me from the hospital. They told me I don't have to be on insulin anymore.
I have nothing but positive things to say about Dr. Weiner. He is the absolute most wonderful physician that I have ever met.
Dr. Weiner, he's the greatest. God bless him.
Visit us here at dmc.org if you'd like to schedule an appointment with Dr. Weiner or learn more about minimally invasive gastric bypass surgery.
The DMC. We just think it's a better way to get better. I'm Emery King.